attention as COVID-19 cases and deaths rise across the state. So do questions and uncertainties about it all.
So we asked you to send in your questions for state epidemiologist Dr. Benjamin Chan. He is joining us live now through Skype for a question and answer session. He is social distancing, and we are here at WMUR as well.
That's right. You may have noticed our shows have been looking a little bit different as we are making sure we are at least 6 feet apart from one another. But now to the questions for Dr. Chan. Good evening, Dr. Chan.
Good evening. How are you?
Good. Very good. Thank you. Amanda asks, if you contract COVID-19, are you able to contract it again? Is it like the flu where there are different strains?
That's a great question. And we're still learning about this virus. But we believe that once someone is infected with COVID-19, they likely have at least short-term immunity. So they're not going to be able to become infected right away. How long that immunity lasts for remains to be seen. There's some new tests that are coming out that can hopefully help answer this question in the future.
Lorelei asked, what's the longest time that someone would be a carrier but doesn't show symptoms?
So this person, I think, is asking about the possibility of pre-symptomatic or asymptomatic transmission. And we know that this can occur with COVID-19, that people can be infected and carrying the virus and potentially spreading it to other people in likely the days before they become symptomatic. But what the exact timeline is, whether it's 1, 2, 3 days, is not entirely clear. When we conduct our public health investigations, we go back about 48 hours from when someone develops symptoms to identify the period of greatest risk for someone transmitting this before they develop symptoms.
This next one's a great one. Jerry asks, with spring weather arriving comes mosquitoes. Will they be carriers and infect people?
Great question. Remember, this is a respiratory virus. So this is a virus that's spread through respiratory droplets, respiratory secretions. So we don't believe that there's any risk from mosquitoes picking this up in the blood. It's going to be primarily transmitted person to person through close contact, in contact with someone's respiratory secretions who's infected.
Stephen asked, do we have a time frame when this should be all cleared up and not a worry anymore?
That is the big question. How long is this going to last for? We believe that this virus will likely be with us. We'll be experiencing an epidemic in New Hampshire likely for weeks, if not months. When we peak in terms of the outbreak and how long this outbreak lasts still remains to be seen, but it's likely going to be a number of weeks, if not months longer, that we're dealing with and trying to control this virus.
Robert asks, when will an antibodies test be available in New Hampshire?
Yeah, this is one of the tests I was alluding to earlier. The Centers for Disease Control and Prevention and other commercial labs are actually in the process of creating and validating tests. Anytime there are new tests that are rolled out, we want to make sure that they're accurate, that they're actually picking up antibodies. And so these tests have been produced, but they're currently being studied to figure out how best to use them and how accurate these tests are.
Okay, Bernard asks, why are there still not enough tests in New Hampshire to get everyone tested, even if they're sick?
Another excellent question. Remember, there's a whole chain of events that needs to happen for someone to get tested. It's not an issue any longer of just having the test kits. A provider who tests someone needs to have the appropriate protective equipment. We need the proper swabs and transport media, and then there's reagents in the lab that are required to do the testing. Many of these pieces of equipment and supplies are in short supply nationally, not just in New Hampshire. So it's a really complicated issue. It's not just the testing machines, it's the protective equipment, the swabs, and the supplies and lab reagents that go along with doing testing.
Dr. Chan, thank you. You're the man with a plan, and we're going to have more questions for you coming right up. Stay with us.